Hair loss affects at least 80% of both men and women, and very few physicians have an interest or expertise in caring for that. There are so many different causes for hair loss, and it's a time-consuming process to figure that out. So we have a comprehensive hair loss treatment center. We do a thorough medical evaluation, and we offer very simple and often very inexpensive medical management techniques that solve the problem for many of our patients. When that doesn't work, we step up and we have other treatments that we can offer as well. The most advanced would be hair transplant surgery, a surgical procedure that we've seen, which involves moving hair from the back of the head to the areas of thinning. It's a beautiful technique. Not everybody is a candidate for hair transplant surgery. So what I'm going to be demonstrating here is PRP, or platelet-rich plasma, which is a treatment for hair loss to both stop the hair loss and reverse the hair loss. And what it involves is drawing the patient's blood and concentrating it into a growth factor rich portion, which is then injected back into the areas of the scalp that are thinning. We can do this once a month or several times a year, and it can be very, very effective depending on what the cause of hair loss is. So we have a number of different ways that we reduce any discomfort. We have a distracting element here called the thumper. We can also use nitrous oxide, but it's for the most part not a very painful procedure. And again, we gently inject superficially into the skin, into the areas of thinning. The blood contains a wide variety of growth factors, and the hair loss process is quite complex. It's a very quick procedure, minimally uncomfortable, and there's really no downtime and no issues after the procedure. So here we're demonstrating scalp micropigmentation, or SMP. So hair loss can occur for many, many different reasons, and although we can sometimes surgically correct, we can use PRP. Regardless, we want to try to make whatever a person has look as thick as we possibly can. And for some people, that's best done with micro dots. So we try to simulate hair stubble to create the illusion of density. Len is the director of my SMP program, and what he's doing is placing tens of thousands of micro tattoo dots in between the patient's existing hairs. It's specialized pigments that we use, specialized instrumentation, and it's a very tedious and very exacting procedure in order to make it look correct. When it's done properly, the scalp simply looks a little darker and therefore less see-through, and it can be very, very effective to hide scars and to add the appearance of density to almost any kind of hair loss process. It doesn't hurt, feels like a scalp massage. It's a very pleasant and relaxing procedure, although it takes a long time because every dot has to be placed individually, perfectly in between each hairs. We'll repeat this approximately once every several weeks until we have the density pattern that we need. And the pigments are permanent, although they do change a little bit with time, which is a good thing as they fade and become more similar to actual hair stubble. Hair transplantation is the surgical correction of hair loss. The healthy hairs can be obtained either with a strip harvest, which is what we've done today, or using the follicular unit excision technique. For the strip technique, after the strip comes out, it's taken to the microscope stations in the far end of the room and subdivided into the follicular units, which are the smallest hair-bearing unit containing 1, 2, 3, or 4 hairs. And then those hairs are implanted back into the scalp to create the pattern and density that we're looking for. A procedure like this can take easily 8 hours, depending on how many grafts that we're moving. And as you can see, it requires a large and highly trained team. It's a carefully choreographed dance so that everything happens as quickly as possible and we get the best growth possible. We really do change lives when we put hair back on the head. Hair is so, so important for our self-image and what we look like. It really does change their lives.